Okay, good afternoon. I am thrilled and honored to be here with you to talk about Medicare for All and what we need to be aware of as we push forward. One thing we all know is it's time to fight hard for Medicare for All. It's time the public got behind a broad, bold vision for health reform that moves us to a single federal health system, treats everyone equally, and reins in costs and recognizes the perils of keeping commercial insurance in the mix. So what are the biggest perils? The good news is, as you know, that a solid majority of Americans support expanding Medicare to guarantee coverage for everyone. And that includes nearly half of all Republicans. That's because it offers true freedom, choice of doctors and hospitals anywhere in the United States, with doctors and hospitals competing for patients and without insurers getting in the way. The bad news is that most people, policymakers, and the general public do not understand that to expand Medicare properly, we cannot split the baby and keep commercial insurance in the mix. We need to cut the overhead and bureaucracy that commercial insurers bring with them. We need to eliminate employer coverage and the job lock it creates as well. We need to bring down costs and drive long-term improvements through a single federal system. Most people, and that includes members of Congress, do not begin to understand key differences between social insurance and commercial insurance. If they did, they would appreciate the dangers of building on our broken healthcare system. They like the fact that Medicare regulates doctor and hospital prices. That is critical, necessary in any viable healthcare system, but it's not sufficient. The problem is not simply costs. Even if Congress decided to extend Medicare's lower prices to everyone and cut our healthcare costs significantly, the U.S. health system would still not be meeting our individual or collective health needs. And this is a point that's lost on a lot of smart people. We need freedom, meaning choice of doctors and hospitals anywhere in the country. We need a system that doesn't ration care. We need to promote innovation that drives system improvements. We need to end systemic bureaucratic waste and profiteering. We need an efficient system. I hope I'm sounding like a Republican, because we need to move Republicans. And these are all values that should appeal to Republicans as much as Democrats. What makes Medicare work is that it is designed for everyone, truly one size fits all, for the public good, not for profit. Automatic, guaranteed, it brings everyone together so that the cost of our care is spread across everyone. Medicare for All addresses the failings of our health care system today. It addresses the unaffordable health care costs that are killing us, figuratively as well as literally. Even with Medicare today, which needs to be improved, as long as you have supplemental coverage, big as long as, your costs are the same whether you need a lot of care or a little. You can budget for your care. You have the freedom to get the care you want wherever you need it, anywhere in America. If you're here in Minnesota at a conference, you can get care. If you're out in California visiting a parent, you can get care. If you're in Delaware with a friend, if you want to go to Texas to MD Anderson, you can get care. Wherever you are in this country, you can get care. That's what we need. Medicare for All gets to the root problem with our healthcare system, which is far more problematic than the costs. It treats everyone equally, young and old, Easterners and Westerners, rich and poor, healthy and sick, no matter where in the U.S. you live. It guarantees us all access to needed care without the burden of high costs if we are sick. It's accountable to the public, not to shareholders. Commercial health insurance limits our freedom to see the doctors and use the hospitals we want and need. It discriminates against people who need costly care. Through narrow networks, high deductibles, and copays, it rations care and does not look out for the long-term collective health of Americans. The commercial insurers claim much of their data is proprietary, so there's a lot we don't know about them. But we all know people with insurance are dying for lack of health care. We all know people who aren't taking their medications because they cost too much, who are not going to the doctor or the emergency room because the deductible is too high, who are making choices that no one should have to make. Our challenge is that we're going to need to make Congress pass Medicare for all. We're going to need to exert enormous political pressure. We're going to need to help the many people who think they're satisfied with their commercial health insurance and who are scared of change think again. It's pretty easy to fear change if you're relatively healthy and use very little health care. It's also pretty easy to embrace change if you understand that you or someone you love is likely, eventually, to need a lot of care that may not be available to you or your loved one in a commercial health insurance system. I love this image of the broken chain. It says it all. Commercial health plans are only as strong as their weakest link, and that link is weak. We need people to understand that these plans almost have to be in a race to the bottom, steering clear of delivering good, affordable care to people who most need it. Think about it. When was the last time you heard Aetna or United Health boast about its great cancer or stroke care? Say, join us if you have heart disease. We want you. In New York, not a single plan on the state exchange includes Memorial Sloan Kettering Cancer Center. Why not? The plans want to keep people with cancer from signing up with them. Where's the health plan that says if you need costly care, you won't have any out-of-pocket costs? That's the one we all want. But you can't get that from a commercial health plan. The more care you need, the more you pay. It's as if they want to make sure you feel the pain financially as well as physically and mentally. Commercial health insurance doesn't work like other commercial products and services. Anyone who thinks otherwise is kidding themselves. Think about it. If the restaurant marketplace worked like the commercial health insurance marketplace, restaurants would be seeking customers who only wanted their free bread and water. Commercial health plans want you to sign up, and then they don't want you to order anything. Okay, maybe they want you to use your free gym membership. But it's pretty clear that their coverage rules, their high deductibles and co-pays are telling you that they want to keep you from getting any kind of high-cost care. One similarity between the commercial health plans and the restaurants. Commercial health insurance offers you a menu. It's just in a foreign language with unintelligible prices. You have virtually no idea which doctors you'll be able to use or what you'll pay if you need care. The cynic in me says that's to make sure you have no clue what you're buying. What happens when people in commercial health plans need complex and costly care? Too often we hear the horror stories. Which commercial health plans are A-rated? Are there any? How would we know? Here's what we know. If we all got together to offer the best commercial insurance available with a robust network or no network, the best hospitals and doctors, we'd be out of business before we opened our doors. Everyone needing costly care would sign up. We couldn't spread costs across healthy and sick. We couldn't afford to deliver needed care. That's the problem with commercial insurance. It's why incremental approaches to health reform that keep commercial insurers in the mix are problematic. They put people with costly needs at risk. And what's worse, they threaten traditional Medicare. Let me explain. Medicare Advantage plans, as an alternative to traditional Medicare, are a perfect example of the dangers of commercial insurance. Their rationale was that they would drive competition, bring down Medicare costs, and give people a choice of health plans. In fact, they drive up Medicare costs, and they take away people's most important choice, seeing the doctors and hospitals they want and need anywhere in the country. Worse still, because they keep out-of-pocket costs low for people who are healthy and shift costs to people who are in poor health, they attract healthier people and leave traditional Medicare with sicker enrollees. We might think of them as corporate take-advantage plans that take advantage of taxpayer dollars and undermine traditional Medicare, or fake advantage plans that disadvantage the Medicare program. Medicare Part D prescription drug coverage is another example of the dangers of relying on commercial health insurance. People get drug coverage, which is great, but through commercial insurance plans that can't rein in costs. They drive up costs, and that's keeping people from getting needed medications, as well as costing taxpayers a bundle. So, what have we learned from the Affordable Care Act in history? Was the ACA progress? Yes, if the measure is the number of people insured and the elimination of pre-existing condition exclusions. But the ACA also took us many steps back. It gave commercial insurers more business, more power. As a result, healthcare costs are even more unaffordable for many. Underinsurance is still keeping people from getting care. What did we learn? We learned that a federal law that subsidizes commercial health insurance costs only grows corporate power. And when it relies on states to implement the law, it leaves commercial health insurers largely free to operate unchecked. Most states, truly all but a handful, if that, don't have the will or the power to protect against commercial insurers. We need a federally administered healthcare system. Okay, why not Medicare Advantage for all? I'm hearing lots of people proposing it quietly now, and I think there's going to be a big push for it. I think that is absolutely the worst proposal out there by far. It scares the hell out of me. Without traditional Medicare, Medicare Advantage plans would no longer be able to piggyback off traditional Medicare rates. Medicare Advantage for all would drive up Medicare spending, since commercial plans can't control costs. Or more likely, to control healthcare spending, government would cut payments to those plans, which in turn would shift costs even more onto the people who most need care. And without traditional Medicare in the mix, as I know you know, Medicare Advantage plans would have even less reason to offer good networks because they would not be competing with traditional Medicare for enrollees. Without traditional Medicare, people with costly and complex conditions would be at greater risk of not getting the care they need in their Medicare Advantage plans. Now, at least they can switch to traditional Medicare when they need costly care, as they often do. So what about the 1 in 3 people with Medicare and a Medicare Advantage plan today? Do they really like it? It's hard to believe they choose their Medicare Advantage plan because of its restricted networks or high deductibles. More likely, they have no real choice. Some employers force retirees to sign up with a Medicare Advantage plan if they want retiree health benefits. Some states force people with Medicaid and Medicare to use only a Medicare Advantage plan. And some people, many people, can't afford the costs in traditional Medicare. The upfront costs in traditional Medicare are about $3,000 more than in a Medicare Advantage plan because you need supplemental coverage. So they can save $250 a month on supplemental coverage if they join an MA plan. My bet is that few people would choose a Medicare Advantage plan if traditional Medicare were improved and expanded and did not require you to pay all that money to fill the gaps in coverage. Why not traditional Medicare for all? Well, certainly it would be a huge improvement, but its design undermines access to care still. I mean, the good news, it treats everyone equally, it guarantees coverage and choice of doctors anywhere in the country, but it's broken out into multiple parts. There's no catastrophic coverage cap. You need the supplemental coverage, and then, of course, there's no long-term care supports and services covered. There's no vision, hearing, or dental. So we need to improve on traditional Medicare. And that brings us to Medicare for all. That speaks to our values. Health care as a right or basic need, not a commodity. Freedom to choose our doctors, the security of cradle-to-grave coverage, affordability, bringing us all together, the efficiencies of one system, the ability to innovate, to have transparency, to see what's working and not working in our healthcare system, and equitable progressive financing. There's only one road to Medicare for all, and there are a bunch of national proposals that are, as you know, taking us off-road. The state work has been amazing. I mentioned here California, Vermont, New York, and they are great stepping stones. They're important efforts, as you all know, to educate and galvanize the public. It would be wonderful to have any state with a single-payer legislation. But what about Mississippi and Louisiana and Arkansas? We saw what happened when we gave states the right to expand Medicaid through the ACA. To protect everyone, we need one program for everyone, and federal law is key. Okay. So what's out there now? We have Senators Merkley and Murphy offering us up the Choose Medicare Act. Okay, the good news, Democrats want another health care debate, yay. They see the problems with relying on commercial insurance, and they see Medicare as a piece of the solution. But bad news. Choose Medicare Act builds on our broken state-based commercial health insurance system. What does it do? It gives people, individuals, and businesses the choice to buy into Medicare if they can afford it and they want to pay for it. And it might sound like a good choice, but no. It splits the baby. It keeps commercial insurance in the mix. It does nothing to rein in costs. It drives up costs in traditional Medicare because people who are less healthy join. It assumes that individuals and companies would benefit from the public Medicare program's strong bargaining power. But it's just as likely that it would weaken Medicare. It would gain a larger pool of people needing costly care, driving up Medicare premiums. Commercial insurers know how to cater to the healthy and steer the less healthy people to Medicare. And it's fair to assume that's exactly what they would do to compete. Senator Murphy argues that their bill is the best path forward because it allows a way to, quote, test the idea that Americans will want a Medicare product. We already know they do. And then we have the Center for American Progress proposal, which is a new enhanced version of Medicare and Medicare Advantage. And it has many limitations, and I'm going to go into them. It is a step up, though, from Merkley. It has some good fixes, beginning with an improved and expanded Medicare program. The CAP plan does guarantee cradle-to-grave coverage for all, and it doesn't rely on states to oversee the system. But even as it creates this stronger Medicare plan, which they call Medicare Extra, it threatens Medicare. It creates a stronger Medicare Advantage option with all its issues and lets people keep the commercial coverage they have if they like it. CAP attempts to level the playing field. They do understand that the commercial insurers are gaming the system every which way they can, and that's a noble effort. But as I think we all know, it's a Sisyphusian task, and likely the plan's Achilles heel. Commercial health insurers have always been able to outmaneuver the federal government, and let's not negotiate against ourselves. So that gets us to Medicare for All. Yay! All right. And we have the Sanders Medicare for All Act and H.R. 676, bold visions. They end commercial insurance. They're efficient, effective. You know it all. Doctors and hospitals competing for patients in a free market with less waste and bureaucracy. Lots of great stuff. Obviously, the Sanders plan is still missing long-term care supports and services. We need that. We have that in H.R. 676. But they're strong, and they speak to our values: freedom, security, unity, efficiency, equity. As it turns out, the original GOP arguments against government-sponsored health care have proven to be the strongest arguments against commercial health insurance. What they said when there was talk about expanding Medicare back when is, quote, "It's crushing cost, wasteful inefficiency, bureaucratic deadweight, and debased standards of medical care." And that is what's wrong with commercial insurance, and that's why we need Medicare for All. We've been working hard, and we've made some great progress. The organizing is working. The stage is set. Medicare for All is in the air. Onward!